Hi, I'm Jenna, the VP of HR Services and General Counsel for Cascade.
And I'm McKenna, the Survey and Research Manager.
And today we wanted to talk about our 2019 Nonprofit Pay and Benefits Survey because we just published the results and we thought it would be fun to go through some of the highlights. And so just a little bit of background about this survey. We do it annually, and this survey is comprised of over 250 different job descriptions, has over 100 benefit related questions. And it provides in-depth market and pay information from nonprofit organizations throughout Oregon and Southwest Washington. So McKenna was responsible for putting this survey together, launching it, crunching all of the data, and putting together an amazing report to help nonprofits with all of their pay and benefit information. So McKenna, I'd love to hear from you about some of the highlights that you found from the survey.
Yeah. So this is actually our third year running the survey, and this year we had 171 participants, and 158 of our jobs have reportable data on them. And so this is very similar to what we saw in 2018. Nice. So this is great because our data is starting to stabilize, and it means we can make more easy comparisons to previous data. We got to see this year some of the top earning positions, which were medical health services director, physician that are board certified, and then also general counsel. We also saw a shift in our demographic, or in our demographics for locations of our participants.
Oh, interesting.
So we previously had a very high rate of participation in the Mid-Willamette area, and that remains steady. However, Portland Metro actually dipped down, and we saw a rise in participation from central, southern, and eastern Oregon. So we have a more holistic view of Oregon data as a whole.
Yeah, nice.
Yeah. So we also got to see some interesting trends with the benefit data. So we saw a dip in the group health plans that are being offered by employers. So actually, this year, only 88% of our participants said that they were offering group health plans to their employees.
And that was a change from previously?
Yeah, we previously were at 98% in 2017.
Oh, wow.
So yeah, so it's still a really big number, but we are seeing it trending downwards. So it's something to keep a lookout in the future.
Yeah.
Also, the insurance offerings to domestic partners is rising. So both for opposite sex and same-sex members, employers are offering more coverage for partners of employers, which is great to see. And then also we're seeing changes in the employer coverage for different health plans. So for the traditional indemnity fee service plan, that's almost at 100% employer covered. So it's actually at 99% right now, which has been trending upwards since 2017. But we're seeing a decline in the employer coverage for HMO plans. So there's some interesting trends going on in health insurance. And so that's definitely something to keep a watch on in years to come too.
Yeah, it sounds like there's some really interesting things happening, especially when it's such a competitive area in terms of compensation and benefits, especially for nonprofits as well. And we also want to thank our partners with this survey. So CSNW Benefits is one of our partners, HealthNet and Jones and Roth as well. So we couldn't have done it without them. So if you're interested in getting information about this survey, purchasing it, getting some of that data, you can visit salarytrends.com and go ahead and purchase that survey and then really dig in and get some great information. And of course, if you have any questions about the survey, McKenna would love to field those questions for you. And definitely keep an eye out. We do a lot of surveys throughout the year, so there might be other information, even if you are not a nonprofit, that we have available for you as well. So we want to thank you, and we will be continuing to get you information about our surveys and other services. Thanks.